Are you a woman who's unfortunately suffering with some form of female sexual dysfunction, such as the inability to get an orgasm that's affecting your intimate relationships, or the fact that your sex is painful for you and putting you off sex? Or perhaps you're a woman who's suffering with incontinence problems, always running to the loo or dripping urine when you cough and sneeze, etc. If you're one of these women, then please listen to my video and I'll tell you how the O-shot could maybe transform your life. So what is the O-shot? Well, the O-shot is literally using and harnessing the power of your own body to regenerate and rejuvenate. And to do this, we use the platelet cells and the growth factors which we can obtain from your blood and injecting them into the vaginal area to transform this area. Let me tell you a little bit more about the O-shot and how it works. Literally, the O-shot is using a technology, a biotechnology called PRP, or platelet-rich plasma. This is where we take a small amount of your blood and we extract the platelet cells which carry growth factors to stimulate tissue regeneration. We can use these growth factors when they're re-injected back into certain areas of your body, and in this case into the vagina and clitoris, to regenerate the tissues in this area. Female sexual dysfunction, as we call it medically, is a complex area, but for most women, the inability to achieve an orgasm or painful intercourse will have quite dramatic effects on their relationships, the intimacy of their relationships, and a knock-on effect to their well-being in their life in general. So the type of patient that comes to see me with these sort of problems can be of any age, but certainly if a woman is really struggling to achieve an orgasm or may not have ever had an orgasm, and some studies show that this is more common than is thought, up to 80% of women have been shown at some point to be faking orgasms to please their partner, and some women have never achieved an orgasm. The O-shot procedure, by regenerating the physical processes, can significantly improve the ability for women to achieve orgasm, improve libido, and reduce pain and discomfort during intercourse. Female urinary incontinence is a well-recognised problem that can start even in early adulthood. Some studies have shown that even from the age of 20, one in 20 women are suffering from some form of urinary incontinence. Certainly this increases significantly following childbirth, and by the age of 60 it's been shown that 1 in 2 people are suffering from significant and often quite handicapping urinary incontinence. Urinary incontinence can take 2 forms, either urge incontinence, where one has an intense desire to get to the toilet and an increased frequency of bladder emptying, making it quite difficult to have normal daily activities without the need to go to the toilet. The second and more common form of incontinence is called stress incontinence, which is where you get small amounts of dribbling and leaking from the bladder of urine during activity. Even simple things such as coughing, bending, lifting, but often with exercise. A lot of women find this quite distressing, and this can really impact their daily lives.
I had the O-shot about a month ago, and I had it basically to increase sensitivity. I heard that it would help with bladder leakage. I heard that it would increase sensitivity, and I heard it would add more blood vessels, capillaries in the area so that you would have more blood flow to the area. It has absolutely increased orgasms in number and intensity. It has also tightened my vaginal region, and it has improved any little bit of bladder problems that I had.
I'd like to highlight through how the O-shot can help patients through some cases that I've dealt with recently, and how this simple procedure has transformed these women's lives. The first patient I'd like to tell you about is Amy. Amy had been happily married for 20 years and was in her late 40s. Came to see me really with a history that her relations with her husband were becoming very difficult due to problems in the bedroom, problems with sex. It turns out with Amy that following the birth of their third child, Amy had lost the ability to have an orgasm. She'd continued to have sexual relationships with her husband on a regular basis, but the inability to achieve an orgasm was causing psychological and emotional distress for Amy. We did the O-shot procedure, and very interestingly, Amy phoned me up the very next day saying that she'd had an intense desire to have sex, and had sex with her husband that night, which was the first time in over 10 years that she'd had an orgasm. She was in tears. It was quite profound, the benefits that this simple procedure had. We followed things up, and certainly over the next 3 or 4 months she maintained that ability to have normal orgasms, and tells me that her family life is so much more positive. She feels much happier in her life, both with her husband and in her work. The second patient I'd like to tell you about, who had the O-shot recently, was Julie. Julie was in her late 20s and had been married for 2 years prior to having their first child. Up until this point, Julie had a very active and healthy sex life and was able to achieve orgasm very easily, and was very satisfied with her sexual relations with her husband. Unfortunately, following the birth of her first child, which was a difficult birth, she had some trauma to the vaginal area, and following this, she was unable during sexual relations to enjoy sex, as it had become very painful. She'd been reviewed by the gynecologist, and everything had healed up well within the vagina, and no cause was really able to be identified as to why Julie was getting pain. But certainly even penetration Julie found very difficult due to spasm in the vagina and intense pain. Julie'd heard about the O-shot procedure can help women who have vaginal pain during intercourse, and came to see me. And once again, following this very simple procedure of injecting platelet cell growth factors into the vaginal area and around the clitoris, Julie was once again able to have normal sexual relations with full penetration without any pain. The O-shot procedure is a very simple procedure. It usually takes around about 45 minutes to an hour. The first part of the procedure is taking a sample of blood from your arm, just as you have a simple blood test or give blood. That blood then is processed using the Magellan cell separation system, which allows me to separate very carefully the platelet cells away from the red blood cells and the other cells within the plasma. The Magellan system then allows me to produce a very high concentration of platelet cells in the remaining plasma, called platelet-rich plasma, and the cells are activated to release those growth factors. The procedure sounds like it should be incredibly painful, but it's not. We just need to use local anaesthetic cream, which is applied to the clitoris and the anterior vaginal area for about 30 minutes prior to injection. The injection of the PRP plasma into this area is then done using tiny needles and is barely felt by women during the treatment following the local anaesthesia. I'm one of the few doctors in the United Kingdom who's been trained and licensed through Dr. Charles Runnels in the USA, who developed the O-shot and P-shot systems. And I'd encourage you, if you're interested in this procedure, to have a look at the official O-shot website. All patients that come to see me who are interested in the procedure will have an initial introductory consultation to discuss the procedure, and I would encourage everybody at that procedure, I would give them a book written by Charles Runnels, which goes into a little bit more depth about the procedure and some very interesting stories about patients that have been treated. So please make an appointment to come and see me, and I'll see if I can help you with this distressing problem.